During this assessment, that is the pre-fasting assessment, necessary changes should happen in their diet or medication regime so that the patients initiate fasting on a stable and effective state. The management of patients with type 1 diabetes is slightly different. Some patients with type 1 diabetes prefer to fast, and most of them change their insulin regimes immediately before, during, or a few days after this month. Management of patients with type 2 diabetes has two ways that we can look into it. In patients with type 2 diabetes who are well controlled with a lifestyle therapy alone, the risk associated with fasting is quite low. However, there is still a potential of occurrence of elevated blood glucose level after the pre-dawn and sunset meal if patients overindulge in eating. So distributing the calories over 2 to 3 small meals during the non-fasting interval may help to prevent excessive rise in blood sugar levels. Physical activity may be modified in its intensity and timing according to the patient's condition. That is 2 hours after the sunset meal. Secondly, patients treated with oral agents, the choice of these oral agents should be individualized and assessed before planning to fast. Pregnancy and fasting. We generally say patients who are diabetic and pregnant should not fast. But in case they want to, women with pre-gestational or gestational diabetes are at a very high risk and may be strongly advised not to fast. However, if they insist on fasting, special attention should be given to the appropriate diet plan and intensive insulin therapy. The issues discussed above concerning the management of type 1 and type 2 diabetes also applies to the gestational diabetic women, with the exception that more frequent monitoring and insulin dose adjustment is necessary. So in conclusion, any patient with diabetes first needs to be pre-assessed before fasting. They need not fast if it is not a spiritual or a personal conviction, and while fasting, to follow the above recommendations.